So good morning. It's lovely to be with you all today. I must confess it's a little bit daunting to be with so many folk steeped in housing. I feel slightly out of my comfort zone. In fact, when Lorna Cameron asked me if I would come and speak to today's summit, my immediate reaction was to say no, because I felt not up to the task, and I'll tell you why. I discovered at a meeting I went to before Christmas, and this was a meeting with a housing association and local government housing colleagues. And the only reason I was there was because my senior team were up to their eyes in COVID response, so I thought I would attend. And quite quickly I realised when I was at that meeting that we really hadn't got the information we needed. We haven't been doing very well in terms of our strategic approach to housing. We really haven't got a sense long term about what it is we're needing. So I confessed this to Lorna, and she said, well, just be honest and tell the summit what you're going to do about it. So today I'm going to tell you a bit about what we're doing. I'm not going to be telling you how fantastic East Renfrewshire is, although we are in many ways, but I'm going to be honest about our position, where we're up to, and what I see as some of the real opportunities for us just now, and tell you a little bit about what we're going to do to try and properly integrate housing into our strategic planning. Next slide, please. So when I realised we really didn't have, as I say, the information at our fingertips to give confidence to the local housing association to invest in developing some local property, I took stock of our position. And as you know, all HSCPs, legislation required that we developed a housing contribution statement, which we did in 2017. And as far as I can see, we haven't changed anything since. We've never updated it. It certainly does not help inform the local authority's strategic housing investment plan. We haven't really corralled the data we have, and we have got some quite good data now on people's needs, current and future. We hadn't corralled that and used it to inform local development plans. And although things are really good operationally, where there are strong relationships and we can often get solutions for individuals, our strategic side is definitely underdeveloped. We started having some really good conversations in locality planning. We started talking about place-based models and community support as part of our locality planning process, but clearly, as in all other areas, this is probably paused in terms of the pandemic response. We've also got limited regular engagement with housing associations, although they're represented in our strategic planning group, but we haven't really taken advantage of their experience and their potential contribution. We do, however, some good news. We've got some really good work to build on in terms of telehealth and telecare. Next slide, please. When I was doing a little bit of reading in preparation for the summit, I spotted this quote in Horizon's research report from 2018. In summary, it's really a recognition that the intent of the public bodies legislation, i.e. that IGBs would have a significant role in shaping housing support and the way that aids and adaptations budget were spent to enable more people to live in their own homes for longer. This had really not flowed through to any structural or funding changes. And that was 2018, and 2 and a bit years on, it still hasn't in our case. My own reflection is that in East Renfrewshire, we put this on the not an immediate priority pile, and we'll get to this a bit later, and it has never made its way to the top. Next slide, please. Although I think the time has come now to make it to the top of our priority list, certainly not perhaps at this very moment, but as we enter the recovery phase we all hope we are moving into soon. And particularly because there are a number of opportunities just now that we really need to take advantage of. The switch over from analogue to digital presents a lot of opportunity for HSCPs and for social landlords to work together to provide more seamless services that are easier to use. Sometimes people have to navigate different systems to get support. So we've got an opportunity ahead of us to collaborate to design a system with the folk we support right at the centre of that. Then we've got the independent review of adult social care. Wow. It's an amazing report. There'll be so many opportunities if the intent of the review is what actually emerges post-election. There's a real focus on prevention in the review and some obvious opportunities for HSCPs to work more closely with social landlords to support individuals to maximise their independence through a combination of good design, technology and joined up working with health, social care and housing support. I'm particularly attracted to the new model of commissioning that's set out in the independent review, collaboration rather than competition, and I can see some real potential for collaborations with HSCPs, care and support providers and housing associations, a little bit like the public social partnerships that we worked on a couple of years ago. I think that could be very exciting. There was also an announcement recently of a community living change fund. So funding is being routed to IGBs through the health boards. And this is designed as bridging finance to help support people with complex needs, often with learning disability and autism, who are stuck in hospitals, a number of folks stuck in short stay units for a number of years, and also in out of area placements. And this fund is intended to help support them back to their own homes in their local communities. And again, there's a real opportunity for the right housing and support, to get the right housing and support for people with very complex needs if we do a bit of planning together. I'm told by my colleague Geraldine that iHub is leading on a new project to support better strategic planning between HSCPs and housing, and we'll be looking at good practice. I think there's an event on the 18th of March, and I'll certainly be booking folk into that. It's come at a really good time for us to start bringing this all together. And finally, the impact of the pandemic has been significant in so many ways, and not least because of the devastating impact on care homes. There are a lot of empty beds. Certainly in my local area in East Renfrewshire, there's about a third of care home beds empty. And that does threaten sustainability for providers, so we need to think differently. We've actually, as HSCPs, got underspends in our residential care and nursing care budgets for the first time for a long time. And I think this is potentially a real opportunity to shift the balance of care, looking at different models of support for frail older people and people with dementia. An epidemic has also highlighted the importance of feeling and being part of a community and how fundamental this is for well-being. The social housing sector has played a really important part in helping to reduce loneliness and isolation, and should be right up the middle of future place-based and locality planning. Next slide, please. So I just wanted to take a minute to say a little bit more about the importance of technology-enabled care and digital healthcare. The developments in this field have also been escalated by the pandemic. Innovations in assistive technology, self-care apps, wellbeing calls, amongst many other things, have really underscored the enormous value of technology to help people live independent and fulfilling lives. There's also been a huge growth in the use of NHS Near Me, both for GPs and for other clinicians in mental health and other areas. And that also offers great opportunity to support people differently in their own homes. Next slide, please. Okay, so I'm just going to tell you a little bit, say a few words about a man that we support in East Renfrewshire to illustrate the difference that the integration of good technology, housing and support can make to someone's life. And I want to thank Sol Connect he has complex autism and anxiety. He moved from living with his parents into quite a traditional group home, where he received 24-hour support and quite often during the day 3-to-1 support. This increased his anxiety and led to a number of hospital admissions. And as you can see, his hopes and dreams were to have a house of his own and to be able to spend some time on his own in that without being crowded by staff and to feel safe. And I'm delighted to say with good technology and good support, he's living a better life. Next slide, please. So I think this presentation, if you could go back one, please. This presentation is a couple of years old, and actually Jamie is now receiving 5 hours direct support a day. He is really being supported well by this technology, and he is able to be much more in control of his life. He's not surrounded by people all the time, and he feels much more independent. Next slide, please. This really just is an illustration that good person-centred support and appropriate technology can be cost-effective as well as delivering good outcomes for individuals. Okay, next slide. Just to conclude, again, when I was preparing for today's summit, I came across this report, which you probably will all know, Connecting Communities, published by Hanover in 2019. And it was a report on an action research project that was undertaken to try and understand how Horizon's staff and residents could work together with local communities to help people live the lives they want to lead. And I was particularly struck by the conclusions which resonated with me, in particular the bit about housing associations being an untapped resource for IJBs. And that certainly has lifted the scales from my eyes. And a bit about it being essential for housing associations to be offered the opportunity to be fully included in the ongoing integration of health and social care. And I think that's our aim for the future. So my last but one slide is really what we're going to do about it. So before Lorna spoke to me, we'd made up our mind that what we needed to do was to develop a housing strategy subgroup of the IJB strategic planning group. We're moving into we've got a 1-year plan just now as a sort of rollover, but moving into another 3-year planning cycle in 2022, and we want a proper strategic housing plan to be very much part of that, and clearly it can influence the council's plans too. Our Director of Environment in East Renfrewshire has agreed that he will put some funding into commissioning a strategic housing needs assessment to give a boost to the work of this group. And I'm hoping what it will do, will really enable a genuine collaboration with our housing colleagues in the local government and local housing associations to develop some innovative preventive services in communities and to see what we can do to explore new models of care. We need to take our delegated functions seriously, so we're going to have a proper look at the funding and the process for aids and adaptations and see if we can make some changes there. And we're also very keen to look at digital at our front door. We've got a post that's just been funded, a peer mentor post being funded by the Technology Enabled Care team. And we think this post will really explore the potential of looking at technology first. And there's a real, to me, that stars are aligning, and it's now a really good time to make housing associations and housing organisations fundamental to health and social care integration.